How can hormones be administered?
So there's a couple different ways to go about it. One way is pellets, which work for some and don't work. They work for some, not for others. This is a very personal experience, so it really just depends on your life and your lifestyle. And if you're not a person that's good about remembering to take your medications or your supplements, pellets are great because it's set and forget it. But the downside is it's an office procedure and it's not typically covered by insurance. So some people, are kind of turned off by that, but it could be a great method of replacement for someone that just wants to set it and forget it. You get a nice steady stream of hormones. It's not favored amongst the, a lot of the hormone replacement community, but it's really a personal thing. The other method is topical therapy. So whether it's a patch or a cream from like a compounded pharmacy where you're still getting a slow delivery because it's going through the skin. And then progesterone I always give by mouth because of the benefits for sleep. And testosterone, typically I do topical. Periodically I have some women that will give themselves a little bit of injection because their absorption might be off and they're not really experiencing the effect from topical therapy.
What are the possible side effects of hormone therapy?
So some side effects from hormone therapy: vaginal bleeding, spotting, breast tenderness, mood. So like I had said before, if a woman has like emotional lability where she's kind of just flat, adding estrogen, she might start getting some of those experiences where you're a little more sensitive to things. You might find yourself a little more tender, I should say, like if you're watching a commercial and it just hits you in the right way, you might start like, why am I crying? So that could be like a side effect, and maybe some bloating in the beginning part of it. I'd say those are probably the most common ones.